Today, we are going to look at a BodyViz brain builder about atrial fibrillation and then walk through a case study example. Atrial fibrillation directly affects the atria of the heart and can have serious consequences throughout other parts of the heart and also throughout the entire body. In this brain builder, we'll take a closer look at the anatomy of the heart and the causes, symptoms, and treatment of atrial fibrillation. The heart has 4 chambers: the right atrium, right ventricle, left atrium, and left ventricle. The right atrium sits on the right surface of the heart. The interior has 2 parts, one with smooth walls and the other with rough, muscular walls and an appendage called the right auricle. It receives deoxygenated blood from the body through 3 openings. When both atria contract, the right atrium pushes blood inferiorly into the right ventricle. From there, the blood is pumped to the lungs to take up oxygen and release carbon dioxide. The interatrial septum separates the right atrium from the left atrium, which makes up most of the base of the heart. It's smaller and has thicker, smoother walls than the right atrium, with 4 openings that deliver oxygenated blood from the lungs. When the atria contract, the left atrium pumps blood into the left ventricle, which then contracts to send blood out to the body. Together, the 4 chambers of the heart make up a powerful pumping mechanism, but only if the stimulating and conducting system is working properly. This system uses myogenic conduction, which allows all the specialized cardiac muscle cells of the heart to communicate with one another and produce coordinated contractions through electrical signals independent from the nervous system. The stimulating and conducting system is composed of 5 parts. The SA node is the natural pacemaker of the heart. It initiates each heartbeat when it spontaneously depolarizes. This causes both atria to contract, pushing blood into the ventricles. The electrical impulse travels to the AV node, which delays the action potential until the atria are completely empty. Then, it sends the electrical signal on to the right and left AV bundle branches, and finally into the subendocardial branches of both ventricles. This initiates ventricular contraction, pushing deoxygenated blood to the lungs and oxygenated blood to the body. The electrical activity of this entire process can be observed on an electrocardiogram. Atrial fibrillation, also known as AFib, is an irregular, uncoordinated heart rhythm. When atrial contractions are out of sync with ventricular contractions, the chambers don't empty and fill properly, and less blood is pumped out to the body. Often, the cause of AFib is some form of cardiac pathology, such as coronary artery disease, an anatomical abnormality, or a history of heart attacks. But other habits and conditions may also play a role. Atrial fibrillation is classified by its duration and general cause. The most common symptom of AFib is extreme chronic tiredness. Other symptoms may include heart palpitations, difficulty breathing, chest pain, and dizziness or fainting. Because AFib hinders emptying of the heart's chambers, patients are at risk of developing clots in the blood that pools in the atria. If these clots travel out to the body or brain, they may cause a stroke. Early diagnosis and treatment is essential to mitigate risk of stroke and death. Diagnosis of atrial fibrillation typically involves an electrocardiogram, which measures and records the electrical impulses of the heart. A portable ECG called a Holter monitor may be worn to collect data for a week or more. Patients diagnosed with AFib are often prescribed a blood thinner as early as possible to prevent clotting and subsequent stroke. The first treatment option for atrial fibrillation is external cardioversion, which uses electrical shock administration to reset the cardiac rhythm. If external cardioversion is unsuccessful, minimally invasive surgical options may include catheter ablation, during which a catheter is guided through a vein and into the heart, where a physician uses a tiny electrode to destroy the malfunctioning cardiac tissue, or a new procedure, which involves the implantation of a small device within the auricle of the heart. One example of such an implant is called the Watchman. The device is implanted via catheter into the left auricle of the patient's heart. 6 weeks after successful implantation, the patient can permanently discontinue use of blood thinners. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age 71, sex male, chief complaints unusual fatigue and racing heart. You invite the patient into your office for an examination. Your patient first came to you, a cardiologist, 5 years ago after a heart attack. Today, he's been sent to you by his primary care physician after complaining of daily fatigue and sometimes feeling as though his heart is racing during the past few months. Your physical examination reveals an irregular pulse, so you instruct him to wear a Holter monitor for 1 week to collect ECG data. The data confirms irregular heart rhythm, and you diagnose your patient with persistent non-valvular atrial fibrillation. As the first step of treatment, you prescribe a blood thinner to prevent blood clots. Then, you schedule your patient for external cardioversion. During the procedure, he is fully sedated. A defibrillator is used to deliver specific amounts of electricity to the heart, interrupting and correcting its irregular rhythm. An ECG monitors the rhythm throughout the procedure and in post-op recovery. It shows a stabilized, coordinated heart rhythm, and you determine the external cardioversion has been successful. Your patient can go home the same day and will continue taking medication to support his heart's healthy rhythm. This has been a classic example of atrial fibrillation. Thank you for watching this Brain Builder video. Please like and subscribe to our BodyViz channel, or if you are new at BodyViz, check out our other anatomy resources and schedule a demo at bodyviz.com.